think it's finally working.
And there we go. Fifth time lucky. An hour later, Maud.
Gosh.
Bad news, girl. Bad news. Okay, so Maud, for the 5th time tonight, we're talking about headaches. If you just joined us on Facebook, we've had some major technical issues. We're probably going to look at a new. If you want some advice, maybe look around and try and find a good streaming service, because Zoom is pretty good, but it's a little bit inconsistent. So apologies for that. We will look around for a slightly better one. But tonight, we're going to be talking about headaches, aren't we, Maud? So let's pick up where we left off, so we're not covering too much ground, because I think it's important just to cover the real critical things that people need to know about headaches. So there's obviously really serious things that are associated with headaches, aren't there? But not every headache is serious, and not every headache is a migraine. So what are the key features of headaches that you see on a regular basis in clinic?
Yeah, so different types of headache that we would see, it's migraine, but we also see tension type headache. So tension type headache is more type of headaches where you get both sides and around the forehead here and around the sides of your head. It's like, we call it sometimes like a hairband headaches, where you have kind of a band of tension through the head and kind of having some pressure. Otherwise, we see some what we call cervicogenic headache, which are headaches that actually comes from the neck, from neck tension, neck problems, and that refer all the way up to the head. That might just be more one side than the other, so that's one of the difference. And we can do a lot of things with that. So we can really help with mobilizing the neck, decreasing the muscle tensions, and everything.
Yeah, good, excellent, good. So before we start to work out how to treat someone's headache, it's really important to work out what the cause of their headache is. And there's lots of different causes of people's headaches, aren't there? So you said you've named a few there. So you've mentioned tension, you've mentioned from the neck, but there are some others, aren't there, that are quite benign symptoms in terms of benign causes. So what are the other things that cause headaches?
It can go from dehydration, lots of stress, lack of sleep, lack of food. So if you don't eat regularly, it can cause some headaches. What else? Bad posture, lots of screening. So if you're looking at computer and kind of squinting your eyes, and that can create eye strain and eye tension that then refers back into the head. And yeah, there's a bit more worrying causes. I don't know if you want me to go into a bit of the worrying causes.
Yeah, there's probably a couple more benign, aren't there? So we haven't mentioned stress. I don't think we mentioned stress. We mentioned tension, not stress. Where there's if anyone's ever had any cold ice cream, ice cream is normally cold, but when you have cold ice cream, it can cause this kind of what do they call it? There's a funny name that people use to describe it. Brain freeze.
Yeah.
Brain freeze. Yeah. So that's a vasospastic condition. So where the blood vessels actually dramatically close down to protect the brain and the temperature of the brain as well, because it gets too cold.
Yeah, and actually talking about stress, what we're going to talk a little bit today as well is about bruxism, so tension through the jaw. So bruxism is basically just when you're clenching your teeth together and then creating lots of tension through both sides of your jaw, and that can really refer and create more tension through the upper part of your head and create headaches as well.
Yeah, it can do, can't it? And we tend to get stress-related headaches after you've had periods of stress. So that's kind of why we wanted to talk about it today, because we're hopefully coming out of the lockdown period, and a lot of people are getting back to doing things. And there's a potential for people to be getting some of these symptoms associated with intense, long, drawn-out periods of stress and the effect on their bodies, isn't there? So headache being one of them. So just like so Saturday morning headaches, they're quite common, aren't they? So we talked about those earlier. What was the cause of the Saturday morning headache, Maud?
Yeah, so main cause are the really busy week, you undergo constantly, you're constantly under some kind of adrenaline and some kind of cortisol. Cortisol decreases inflammation in the body, so it keeps you from feeling all of the sickness feelings. And so when you arrive on Saturday, your body has a chance to relax and everything just calms down, and then your cortisol level drops down as well. And so all of the inflammation kind of comes up, and you can then feel a bit more sick, starting to feel headachy and just feeling a bit under the weather.
Yeah, so that's really quite important, isn't it, that you get a very clear idea of what's causing your headache. So so once we've diagnosed someone in terms of found out what we think's causing their headache, we may have gone through some tests, spoke to their GP. There might be some other things. If you're watching on Facebook, if you've had a headache before, what have you done to find out what's going on with it? You might have just taken some painkillers and it may have gone away, it may not have gone away, but what do you guys do at home if you've got headaches and you want to find out what's causing it? But that's kind of what we do, isn't it? We'd go through and we'd find out, because typically when people come to us and they've got headaches, they've normally had them for a little bit of time, haven't they? They're not going to have initial headache and they're going to reach for the painkillers first, aren't they? They're not going to come and see someone to get it sorted out.
So we'd start asking lots of questions and trying to find what you call those triggers. So anything that's triggering the headache, we try to find that out. We try to find out when is there a time of the day where it's more common, a period during, for example, in women, hormonal cycle as well. So sometimes hormonal changes can sometimes create headaches. So we would look at all of those things to try and help the person the best that we can.
Yeah. In terms of, I'm not sure if you know the exact answer to this, but do you find that the diet's related to hormonal triggers?
Hormonal triggers, I'm not entirely sure. I know diet has definitely some trigger for headaches. For example, alcohol for some people, or cheese and things like that. Some people have that as a trigger. Hormone-wise, I could potentially. I've never heard of it like mainly, but it could make sense actually. So
yeah, it does. So with some of the main triggers or some of the main supposed triggers of migraine and headaches tend to follow this pattern, don't they? So it's cheese, chocolate, exercise, so excessive exercise or no exercise, stress, travel, anxiety, sex. I've had some patients come in and say they get a particular type of headache when they have intercourse, so that's quite an unusual one to get, but certainly one you don't want to be missing, because that can be a sign of increased blood pressure, can't it? So you need to watch out for that one. So what else? Obviously trauma is another cause of headaches that you mentioned earlier. Great. So once we've worked out what's going on with the headache and the head, and we're quite clear that it's coming from their neck or it's tension or it's coming from their jaw, what kind of things would we do with people in clinic?
So first thing, we do lots of tests, but then I think we would, if it's from the neck, we would look at the neck over exactly where it's coming from. So muscle tension. So we would release those muscle tension by doing some treatment, showing some exercises that they can do at home, trying to work a bit on the mobility as well of the spine, and potentially even lower down into posture and how they're working at the desk, for example. If they tend to have headaches at the end of the day, it might be how they've been like throughout the day. So we look at that. If it's tension, is as well of the triggers. I always say kind of do a diary of your headaches and try and find out what's causing it, and then you can manage your day. So you can do lots of management work with your patient and headaches. So it'd be managing how much they drink, how much they eat, trying to decrease the stress levels, trying to sleep better, do some sport if that makes it better.
Yeah, it's really important. So I think what you're describing there is quite useful because it's very pragmatic. So you're looking at the low-hanging fruit. What are the general day-to-day things that people can do to stop the headaches being triggered off? If the headaches are triggered off, what can they do to help deal with the problem? I think sometimes it's quite nice to come and speak to someone who knows what they're talking about to get a really clear picture over piecing it together. I think sometimes I feel a bit like Sherlock Holmes. Do you know who Sherlock Holmes is?
Yeah.
Yeah. Do they have a French equivalent of, or Belgian, a Flemish equivalent of Sherlock Holmes?
Not exactly, but they have Inspector Poirot.
Poirot.
Oh, I think that's from, I'm not gonna say something wrong. Is it from Agatha Christie? If
Agatha
I'm correct.
Christie. Yeah,
But
exactly.
he's
Yeah.
Belgian, actually, I think. So
Yeah,
we have
excellent.
him.
Yeah, Flemish. So yeah, so I feel like Sherlock Holmes sometimes, because the whole purpose of your interaction with the patient, isn't it? Is to look for these little clues with regards to what's going on, build a full picture, and then try a few things, because we don't know exactly what's causing it, and that might involve sending someone for some tests, or sending them to the GP, or working with their physio, or working with other people. But there are lots of different ways to create that interaction, aren't there? So yeah, it's quite a good job. I like my job.
Mhm. It's
Yeah,
interesting with headaches as well.
it is, isn't it? So
It is like picking everything of their lifestyle, and then you're trying to, yeah, to piece it together.
you precisely, yeah, and there's simple things that people can do, aren't there? With, if they've got like lymphatic congestion, you were saying about some little things that people could do. So do you want to just describe those, maybe?
Yeah, so there's great things. So especially at the moment, I think I actually gave that advice to my mom that was having some kind of eye pain because of she was looking at screen the whole day.
Yeah.
And so it's some massage that you can do on your face, just on your own at home. So things like, so you would start probably doing some circular motion all around your face. So you start from the top and then coming to the lower part. And then once you've done that, you can do that 2 times, and then you kind of what you call milking it. So you rub it down, and that's to make it kind of come down all the way into the vessels that are in your neck, and then draining in through the shoulders. And for the eye in particular, it's exactly the same. You do one at a time, and you do some circular motion, so towards your eyebrows, so towards the inner part, and you go all around your eyes. So take a little bit more time than I do. I'm just showing you. And then you can do that two circle around your eyes, and then the other side, same thing. That activates all of your fascia, so that moves all of the tissue just under your eyes, that moves all of the vessels, and that's pumping everything in and out, trying to drain everything from your face.
So when you're doing that, it's quite light contact, isn't it? It doesn't
Yeah.
look like you're really pressing inside the face. But what's the purpose of the light contact when you're doing lymphatic work?
Yeah, so you're staying very superficial. So you're staying through the skin, and then the first little vessel just as they come to the edge of the skin, and then into the fascia. That's a type of tissue that's just under the skin as well. So you're staying very superficial, trying to get everything to move, and then the tension within that to release.
Excellent, good, brilliant. Are there other things that people can do? Because one of the other causes of people's headaches up here tends to be their jaws. So the muscles that come through the jaw area there, actually they're attached, a lot of them onto, one of them onto here, but the other one mainly is attached onto the side of the head. So that's quite a common area to experience headaches, isn't it? That temporal region.
Yeah. Exactly. So for that same thing, little massage types. So if you put your hands on both sides of it into just where, so you have the bone of your cheek here that you follow to the back of your hairline, and then you just go up of that, so above, and then you'll just kind of do some circular motion as well. Take your time, kind of slow circular motion. I'd say I'm applying a little bit more pressure on that one than on the ones around the eyes and the skin, just because I'm trying to reach as well for the muscle, which is a little bit deeper than the skin.
Yeah.
So a little bit more pressure through here. And then, as you said, there's a few through your jaw and just into your, behind your teeth here. So same thing is here, you can apply light pressure. So it's same cheekbone, but coming below it. And then you can apply some pressure through there. And sometimes you can find some trigger points. The trigger points are really tender points within the muscle. You can find some trigger points in there, and it can be quite painful sometimes. But if you find some, just apply some pressure and wait until you release a little bit.
Yeah, no, very interesting. What was I going to ask? So there's one cause of headaches that happens here, isn't there, that you don't want to miss when it comes to that kind of soreness that you get around here, but it tends to occur with other things as well, doesn't it? So one of the, if you look at most medical conditions, actually, the headache is very common amongst lots of different conditions, and it's a symptom of general poor well-being. So the condition is called temporal arteritis, and it occurs in people with polymyalgia rheumatica. So that's an autoimmune condition or rheumatological condition that affects can affect the blood vessels in particular, and affects joints as well. So you don't want to miss that one. But certainly, if you've got pain here, you should really see someone that understands a little bit about the different causes of pain in that region and be able to focus on that to get answers for you.
Because that's some things that we can see as well, because they get joint pain as well, shoulders and hips and things like that. They would kind of tend to come with that, and then we would ask more questions. That's why questioning is really important, and we do ask a lot of questions. Do you get headache? And that might be another piece to the puzzle, and to add on.
No, super important. So that's definitely something not to miss. But I'd be interested, if you're on Facebook right now and you listen to this, how many people have had headaches? So just give us a like if you've had headaches, so that we can see if you've had headaches, and drop a comment in the comments box below if you found certain things have worked for you. And it'd be really interesting to hear about some of the things that you guys are finding successful when it comes to treating your own headaches at home as well, so we can decipher the headache mystery. But that would be really fascinating. Maud, is there anything else that people at home would like to know about headaches?
I don't know if you want to talk a little bit about migraines.
Yeah, migraines would be interesting, because there's a very clear differentiation, or well, a very mixed picture, isn't there? Sorry, between migraines and headaches, but there's thought to be a very clear differentiation because they're categorized in certain ways, aren't they?
Yeah, so people sometimes when they have a headache, they directly say I have a migraine, but it's actually very different. And actually a migraine, if you really have migraine, you usually get kind of diagnosed with it.
Yeah.
And there's two types of migraine. There's a type with aura and without aura. So aura, basically, it's neurological symptoms. So when you have aura, it means that you have some change in your neurological system about an hour to 30 minutes before the actual headache.
Yeah.
And that can be everything from visual disturbances, so seeing spots, seeing double, to be to bright lights and things like that, to extreme things that can happen.
Well, people can lose sensation or motor control down half of their body, can't they? So we had someone in recently that had, I think, a bit of a nutritional deficiency, and actually what was causing, what we thought was causing some of the issue was a B12 deficiency. So we sent her for some tests. She's had some tests. We gave her some supplements, and she's working with the doctors, but it's completely cured her headaches, which were a very unusual diagnosis of the problem. So it's it's very interesting. But I think that's testimony to trying to work out exactly what's caused the person's problem, isn't it? Because a lot of the time people, they take painkillers, or they take aspirin or Panadol, whatever they take to help relieve their headache, but it's just masking that a symptom of something else, isn't it? So
and I think actually, like, some headaches, some painkillers don't work for one type of headaches and the others as well. So sometimes there's some headaches that just a normal paracetamol, something like that, or Nurofen would not touch. So it's that thing as well, differentiating between different types of headache.
Yeah, good. Are there some unusual cures for headaches that you've come across?
I can't think of anything now. I think a lot of I had some people with the type of migraine with aura that had these stroke type symptoms, when she would start slurring her speech, start can't speak
that's quite
anymore.
scary, isn't it?
Yeah, would lose completely, like, sensations and motor ability on one side. And
Maud, can I ask you a question? When you've got someone like that in clinic, how do you tend to approach it? Because it's obviously, you could say, oh, it's just a migraine you're having, and let's say it's their first occurrence of that, it's first episode.
Yeah. So if it's the first episode, it's directly to A&E and get it checked out.
100%.
So I only treated that patient because it was diagnosed by GP and by consultant, having gone to A&E many times. And so you know exactly what's happening. But even if she knew exactly what was happening, she was still asked every time she get a headache to get it checked out afterwards, because, or even while she's having it, because you can never be 100% sure that it's coming from the headache.
Yeah, definitely. Yes,
yeah,
if you're watching live on Facebook now and any of that resonates with you, we'd love to hear back from you with regards to anyone that's suffered with this kind of very severe hemiplegic migraines, or if you suffer from migraines on a regular basis, what are you doing to get rid of your migraines? We'd love to know. We'd also like to hear from people who have been able to overcome their headaches or find the cause of their headaches as well, and what kind of solutions they've found as well. So if you're watching live, put the details in the comments box below. If you're watching on the replay, just put hashtag replay and pop the question in, and we'll be able to come back and cycle and answer your questions with regards to things that have gone on with regards to your migraines. And of course, if you haven't found a solution to your migraine or headache, we'd also love to hear from you to see if we can help you find a solution as well, quickly, affordably, and without going through medication, hopefully. But let's have a chat, and we'll open up the discussion right now on Facebook and try and help you guys out. So Maud, what else can we tell people about headaches and migraines?
Well, I think we talked about all of these like scary neurological symptoms, but that's actually only 20% of the migraine. So the 80 other percent is migraines. So migraines in general would come into kind of the head over here, usually, sometimes behind the eyes. Come into, you have chronic and episodic as well. So it depends. So chronic is when you're having it really regularly. Episodic is when it's a bit less regular. And I lost my train of thought.
You're talking about different types of migraines, chronic, episodic. You were talking about the presentation in terms of the way that people come into the clinic and how they present.
Yeah, so one other common symptoms in migraine actually as well, it's what we call photophobia and phonophobia. So that's when you have sensitivity to light and sensitivity to noise. So usually those people close the curtains, get in the bed, need no noise, and just kind of try to go to sleep and try to get everything to buzz out from the nervous system. Because one of the thing with headache is as well, and migraines, it's when you get a oversensitized nervous system. So you get all of this information just kind of attacking you, and your brain or your nervous system is just too much. And so it comes to create a headache.
Overloaded, yeah. So that sensory overload is quite a common feature of migraines in particular. But it is it's an interesting feature, isn't it? Because you have sometimes you have like dark holes in terms of visual field. So can make you like temporary blind in some areas. So people get very scared by that because it's a very severe symptom. There are some causes of headache where you can have kind of loss of vision, where the vision doesn't come back. So they're ones you want to really watch out for, because when people are having, obviously a stroke is a big cause of that. You definitely want to watch out for that. If you're losing vision in your eye with a headache, you could have raised intraocular pressure. So that could cause problems. So it could be glaucoma related. You could have visual problems there. One of the other less common things, but it's certainly one that you don't want to miss, is a detached retina. So when that retina detaches, you have something called, I think it's called Amaru Fugax. Do you remember that from your?
I don't remember that.
Okay. So it's basically where it's like, it's called, I think it's, what's Amaru Fugax in French? Is it French? It might be. I think it basically means curtains descending, is the technical name. But it's like the person comes in and they describe, doctor, it's like the curtains just descended and I couldn't see anything after that. Unfortunately, that's definitely something not to miss, because the detached retina is like hugely important to pick up very quickly, because if you don't pick it up, then the person ends up with blindness in their eye. But when you've got someone with that kind of curtain descending sensation that they're describing, the treatment is actually, once you've diagnosed it, you've looked inside their eye, is actually to get them to lay as flat as possible for as long as possible, see if it takes and it attaches again. Sometimes it doesn't, and then they need to have surgery to reattach it, which is last resort, but it's a very important thing not to miss as well. So that can present with headaches as well. So that's quite an important thing as well. Interesting, isn't it? Lots to talk about with headaches, actually. A very common thing, and it's most of the time very benign, but so much history goes on around that.
And you get a lot of crazy things, like really painful, like, I don't know if you're going to talk about, like, trigeminal neuralgia and things
Yep.
like that. Like, so that's just when you get really a lot of pain through one side of your face, so a complete side of your face, eyes, nose, cheek, and everything. It's extremely painful. I think it's one of the most painful condition.
Yeah, it's very uncomfortable, but it typically occurs in one or two of the branches of the trigeminal nerve. So there are three branches, and they basically span out across your face like this. So you've got the upper branch here, the middle branch, then the lower branch. So those three branches are all a part of the same nerve. And when it becomes like very sensitive, the skin becomes very sensitive on the surface of the skin. It's often like one or two of those branches that can get affected at the same time. What are the main causes of trigeminal neuralgia?
It's a bit unclear actually. Like nobody really knows, but it's hypersensitivity of the nerve. So it's the nerve suddenly become really really sensitive on anything that you do. So if you stroke the cheek, yawn, even yawning. So when you open your jaw, brushing teeth, even sometimes talking for people, all of that becomes very sensitive and can trigger an attack. So these people then get very scared about doing all of these things. It's usually as it passes through there, through the narrow passage, through the bones, that it can get a bit irritated and then create this hyperinflammation and hypersensitivity.
Yeah, it's interesting, isn't it? Because the nerves are actually buried underneath the skin in the actual face itself, and they come out of three holes. So one here, one just above the eye. So they cover these areas here. There's another nerve here, the facial nerve, isn't there, that comes out from just behind the jaw there. And that's mainly a motor nerve. So when people have problems with the facial nerve, what they often describe is this ptosis, so their eyelid drops down and they can't close their eye. They describe something where the side of their face feels like it's dropping down, so they feel like they're having a stroke, and they might look like they're having a stroke, but it's not a stroke. It's something called Bell's palsy. So Bell's palsy is when the facial nerve just behind here gets affected, and that causes motor symptoms in the face, which is very different to trigeminal neuralgia, isn't it?
Which is sensory.
So mainly sensory, yeah, mainly sensory. There is a small motor component where people get hyperacusis, so they can get the ear can be affected because of the branch of because of the sensory perception of the trigeminal nerve in the ear. So that's quite important. But also, what's confusing is that the facial nerve supplies a muscle called stapedius, which attaches to tensor tympani in the eardrum. So that makes you very sensitive to very loud sounds. So that can be a real nightmare to try and diagnose with people who've got ringing in their ears and facial pain, or facial symptoms. So that's very interesting.
Yeah, the face and brain is very complex. I remember learning everything about it. It's like all of these holes and lots of different nerves just going to everywhere. But that's how we can speak. That's how we can do all of this facial expression. And it's so small movement, isn't it? So
yeah, it's very small, but it's clearly a very complex area above the head here. So above the neck and shoulders. So anything that goes on above there, and you've got symptoms, then it's always a good idea to get a very clear diagnosis, get a real good understanding with regards to what's going on. If you've had it for a long time, certainly don't be quite open-minded. I think sometimes people don't persist with treatments for long enough to get to the end result of fixing the problem, or at least managing it better. Not just coming to see osteos and physios, but getting the right medication. So medication often can take a little bit of time to get the right type of medication to get things to settle down. Dietary changes, again, it's not instant, but it can happen instantly. But typically it takes a little bit of time for their body to get used to the increased levels if they've got a nutritional deficiency there. But yeah, lots going on with regards to migraines and headaches. So Maud, we better wrap it up there. But if people are struggling with headaches and migraines and they want some more advice, how do they get hold of you? Because I know you see a lot of people with migraines and headaches, don't you?
Yeah, so I'm still available doing online sessions like this. So it would be on a call like this and then talking about everything, every symptoms that you have and how we can help you. how to do that, it would be to contact the Perfect Balance Clinic, so the reception number, and just ask who is best to see. And headaches, yeah, I'm really interested about headaches and really passionate about it. So I'd love to see any of you if you need help with that and trying to manage it.
Great. And if you're watching this on replay and you've got some questions, just leave them in the comments box below, and we'll pass them on to Maud, who will be happy to come and answer your questions. We also offer a free service for people to come and get advice from us online. So they're able to have a quick examination, a bit of a history taking as much as possible, so that we can give them a rough idea with regards to what direction to head in or what they should be trying. So if you'd like to get advice about your headaches or migraines and you're listening on Facebook, or if you're watching this on replay, don't forget to leave your details in the box below. Maud,
Yes.
It's been challenging, hasn't it, tonight?
Yes, it has.
Getting live. But listen, that was worth it. Big time. I think hopefully we're going to be able to help a lot of people with a very common symptom of migraine or headache. So that would make my day if all of that struggle was worth it, just like that, to help one more person. But that's brilliant. Listen, it's been great speaking to you. And for tonight, it's bye-bye from me.
Bye, everyone.
See you later, guys. Take care. Have a nice evening.